One of the challenges couples face in fighting prostate cancer is dealing with the resultant side effects that can be seen with treatment. Erectile dysfunction continues to remain a common problem after treatment for prostate cancer. Today, we are very lucky to have on the show men's health expert Dr. Jesse Mills to tell us a bit about a new novel approach in restoring erectile function after radical prostatectomy. So the big question is this: how can men and those who care for them better educate themselves regarding prostate health, the conditions that affect the prostate, and the latest technology in managing these conditions? That is the question, and this podcast will provide the answers. On a weekly basis, we will be chatting with experts, innovators, and leaders in the field of urology, sharing useful information with the general public to improve their lives and increase their overall health. My name is Dr. Garrett Pullman, and welcome to the Prostate Health Podcast. Prostate Health Podcast is for informational purposes only. Nothing in this podcast should be construed as medical advice. By listening to the podcast, no physician-patient relationship has been formed. For more information and counseling, you must contact your personal physician or urologist with questions about your unique situation. It is an honor to have Dr. Jesse Mills on the Prostate Health Podcast today. Dr. Mills is a board-certified, fellowship-trained urologist who specializes in male reproductive medicine and surgery with a busy practice focusing on vasectomy reversal, sperm retrieval, microsurgical varicocelectomy, Peyronie's disease, and penile implantation. He is Associate Clinical Professor and Division Chief of Andrology at UCLA. His clinical specialties revolve around men's health and include male hormone management, sexual and ejaculatory dysfunction, and male infertility. I had the pleasure of first meeting Dr. Mills as I was starting my residency in urology at the University of Colorado, where he was just finishing up as chief resident at Colorado and heading off to start his fellowship in male reproductive medicine and surgery at Baylor, and since then has really blossomed into a national expert in men's health. Dr. Mills, welcome to the Prostate Health Podcast.
Jared, thanks so much. A great introduction. It's an honor to be here and sitting in front of you and your audience.
Well, Dr. Mills, one of the challenges of fighting prostate cancer is some of the resultant side effects that we see with treatment. For many men, erectile dysfunction remains an ongoing problem for men and their partners after treatment for prostate cancer, including radical prostatectomy and radiation. Can you explain to our listeners, how can prostate surgery and treatment for prostate cancer affect a man's ability to achieve an erection for intercourse?
The pelvic anatomy is actually some of the most complicated anatomy in the human body, right up there with the brain and the head and neck, because there's so many nerves and blood vessels that go into the pelvis, and the penis is a pelvic organ, whether we think of it as one or not. In other words, when you look at a naked man, you're only seeing about 2/3 of his penis, and the rest of it actually is buried deep within the pelvis. Turns out prostate is all about real estate, and the prostate is in a very, very dicey part of the anatomy. It's sandwiched in between the rectum and the bladder, and on the outside of the prostate are the nerves that then go into that pelvic organ, the penis, and those nerves are what control erection. So there's no free lunch in prostate cancer treatment, whether you elect for radiation or whether you elect for surgery or cryotherapy or HIFU or any of these newer technologies. At the end of the day, you're going to have some kind of hit to your erectile ability. With erectile dysfunction after prostate surgery, the most common thing we see is that the nerves that supply erections, even if your surgeon does a fantastic job at doing a nerve-sparing surgery, they still have to be delicately swept aside, for lack of a nicer term, in order to get the prostate out and sew the urethra and the bladder back together. And in that period of time, those nerves don't function as well, and they can go through a period of time that we call a neuropraxia, much like hitting your funny bone where half of your hand goes numb for a period of time. It's the same thing. Those nerves just don't work the way they should, which is to supply blood flow to the penis during an erection. So prostate cancer surgery is something that a guy pays for up front with his erectile damage. The nerves either get cut entirely or at least get sort of buggered around with and take a little while to recover. So it's mostly a nerve issue. And with radiation, it's very different. Radiation, the nerves are essentially spared, But what happens is the blood vessels that supply the erections to the prostate, they get a little bit of scatter radiation and they fibrose. They turn, instead of into nice spongy muscles that flex and fill with blood to give us erections, they become much more stiff, less compliant, and the erection slowly fades away. So when I'm counseling patients about what sort of procedure they're looking at to curative intent for their prostate cancer, I say that the damage from radiation you may not see for 3 months or 6 months, but eventually you'll get to the same place the guys that have surgery is, which is a significant impairment in erectile function, unless you do something to make that better.
And that leads us into our next question. And, what are some of the advances that we've seen over the years in trying to improve outcomes for erectile function, after prostate removal?
Right. So the modern era of prostate surgery, you could trace back into the early 1980s and the seminal work that Pat Walsh did, which really established the urologic oncologic principles of nerve-sparing prostatectomy because of the fantastic cadaver work he did that led to these discoveries of these nerves. And so that was in the early 80s. And yet, even today, and when a guy goes into an operating room, he has to be counseled that with a perfect nerve-sparing prostatectomy, he still has some chance of erectile dysfunction. So here's where the devil's in the details, Garrett. What a man considers erectile dysfunction and what a surgeon considers erectile dysfunction are not always congruous. So for me, as a urologist that actually doesn't do prostate cancer surgery anymore, I've really specialized, as you introduced me, as purely doing sexual and reproductive medicine. I can say to the guy, look, here's what's going to happen. Your surgeon's going to give you a great nerve-sparing procedure, but you're still going to have a reasonable chance of erectile dysfunction. The classic, you patients may have heard and your listeners may have heard is somewhere like a 50-50 chance of ED. Well, what does that mean? So for me, when I'm talking to a patient, I want to know, and they want to know, are my erections going to be good enough for penetration and to complete the orgasm? So those are two critical questions. Can you sustain an erection strong enough to have penetrative intercourse? And can you maintain that erection long enough to finish? And if you look at those criteria, sometimes the erectile dysfunction rates are much higher. So if the surgeon says, hey, I did a nerve-sparing surgery and the guy's getting a 50% erection, yeah, you definitely spared his nerves, but he's not having an erection suitable for penetration. So here's where science comes in. Here's what we've been doing over the last 40 years or so since we started to understand the function of those nerves. We know that if we do something to protect those nerves as a man is convalescing from the surgery, then he may have a better chance of recovering function. And so that's where what we have called rehabilitation protocols come from. At UCLA, over the last few years, we developed a protocol that I call Prehab, which is basically seeing a man a couple weeks before his prostate surgery, counseling him on the sexual dysfunction side effects, because it's not just about erections. So you see your prostate cancer surgeon, he or she is going to go through all of the details of the cancer operation, but they may not mention that not only you're going to have an issue with erection issues, but you're going to lose your ability to have an ejaculation and your orgasm will be spared. And by that time that the patient hears the word cancer and he's swimming around in the whole cancer diagnosis, they're going to forget about the whole sexual dysfunction thing until they realize that, A, my erections aren't so good and I'm not climaxing anymore. So that's where we come in as reconstructive urologists and sexual medicine specialists. Is I say, look, I want me to worry about that. I want you to worry about getting better from your prostate cancer surgery. And while you're doing that, if I put you on some daily medications, which are well known to everybody, they're essentially in the class of Viagra and Cialis, we know that can help the nerves recover a little bit faster. We also know that if a man uses a vacuum erection device, which has been around for 60 years now, every day or at least 5 days a week, it can decrease the amount of penile atrophy or shrinkage that a guy might go through after his surgery. So the mainstays of this prehab protocol, good counseling, lifestyle modification. I'm a men's health expert at heart, so I want to make sure he's got good nutrition, good exercise, good sleep, good support, good psychological and mental health. And then the daily phosphodiesterase inhibitors, those are your Viagras and Cialises and a vacuum erection device. And we know that if a guy does that for 6 months, his chance of being able to have penetrative intercourse and finish are upwards of 80%. So that's where we've moved. We're basically taking a bunch of stuff off the shelf and put together a recipe that we've validated and published, and it seems to work. So majority of guys that go through this prehab program will get erections good enough for penetration and orgasm post-operatively.
Definitely some valuable information so far. We're going to take a quick break here, then we'll be right back for more with Dr. Mills. Thanks again for joining us today on the Prostate Health Podcast. Now, do you have an upcoming appointment at the urologist office? Maybe you're scheduled for a biopsy of your prostate, or just received the news that your biopsy was positive for prostate cancer, and now have an upcoming consultation to discuss options with your urologist. You may be wondering, how should I prepare for these appointments, and what should I expect? Well, I've partnered with the Prostate Health Academy to create a free What to Expect guide that will help get you up to speed as you prepare for your visits. This guide includes checklists of what you need to bring and how to prepare. This guide includes what to expect with 3 different scenarios, including your initial urology clinic appointment, a prostate biopsy, and prostate cancer consultation. To receive this free guide, simply go to www.prostatehealthpodcast.com/clinic. Again, that's www.prostatehealthpodcast.com/clinic, or you can find the link on our podcast website at prostatehealthpodcast.com. Well, Dr. Mills, you already alluded to some of the findings in this study, but again, you recently published the results of a new novel approach to post-prostatectomy recovery of erectile function. Any other important findings from this study?
Right. So the main thing is we think that the preoperative counseling, where we engage a man and his partner prior to surgery, helps them set the stage. And I always talk about this when I'm meeting a patient in person. I say there's 3 C's after your prostate cancer surgery. You want cure, you want continence, and you want coitus. And you want it in that order. So the cure part happens in the operating room. You hope you have a great surgery, you have a margins negative, and your PSA goes to 0. The continence part, of course, is making sure that men are comfortable doing Kegel exercises, doing everything they can to stay lean, because we know that obesity is associated with worse outcomes for stress incontinence. You've got all that weight pushing on the bladder, and all the bladder can only do so much to hold the urine in. So good weight loss, good exercise. And then the coitus we discussed with the PDE5 inhibitors, those Cialis and Viagra, and the vacuum device, and patience. So that's the 4th thing, is that when I see a man at 2 months post-operatively, and I've counseled him ahead of time, 20% of guys, just 20%, are going to be able to get erections good enough for penetration. So when I see a man, I tell them, most likely I'm going to be more of a coach than a physician during your process. And at the end of treatment pathway, I am a surgeon, and I perform a lot of penile implant surgeries. So not everybody gets better, but again, 80% or so chance that I won't have to operate on you, but I need you to be patient along the way. I need you to keep making your follow-up visits. So that's the second big thing from that article that we found, was that compliance, 4th C, I guess, is key. So if a guy, I see him once and he doesn't come in for his 2-month visit, he doesn't come in for his 4-month visit, and then he comes in at a year and says, well, my penis isn't working anymore, it's broken, it died in the operating room. I say, well, where were you at 2 months and 4 months and 6 months when we could have done things to intervene? So patient investment is huge. And I know just from your audience alone, the fact that they're tuning in and listening, you've got invested patients, and that's what we need. And we don't need us to fix everything as physicians. We need that dialogue and that investment of a patient's time and ability to do the things that we ask them to do to have the best outcome possible.
That's great. Well, and I know this show is directed, towards the general public, but I know we have a lot of urologists and physicians that are listening, and I'm sure a lot of them would be interested in your protocol. I mean, where would be the best place, or could you give that reference as far as the...
Sure. Yeah, of course, Garrett. It's, the best thing to do, I think, when I'm looking for anything is I go to Google Scholar first, if I didn't have PubMed access. And if you it's in the International Journal of Impedance Research, and we put it out late last year. So I don't have the perfect citation on, but probably putting in my name and International Journal of Impedance Research through Google Scholar will get you there. And it is a cookbook. I mean, again, this is open access. That's the beautiful thing about science, is that there's nothing proprietary about what we do. We just tried a bunch of things and found what seems to be the most effective and very cost effective. I mean, the great thing about 2020, and actually even after 2017, is that all the medications for erectile dysfunction are essentially generic now. So, you can go to your local grocery store and buy a tablet of tadalafil, which is generic Cialis, for probably 30 cents. So this is less than, your daily coffee habit for sure. And so that makes it very internationally relevant as well, is that we can take this in any country and treat men at any socioeconomic level with this and provide that optimal sexual health at any price point.
Well, that's great. And what we'll do too for our listeners is I'll take that link and I'll go ahead and just put it into our show notes so that way they can have direct access to it. So I think that'll be perfect.
Perfect.
So in summary, Dr. Mills, you really continue to deliver up value for men's health, particularly with this recent study looking at this new novel multi-modal penile rehabilitation protocol, or prehab, which involves this prehab phase and showing improved return of erectile function for men following their prostatectomy. I understand that you're currently working on a men's health book, and I thought we could just quick touch on that and maybe give a quick teaser for our listeners. I really want to get you back on the show when it gets closer to putting that book out, but I didn't know if you wanted to tell our listeners a bit about that upcoming book.
How could I not want to do a shameless plug, Garrett? Of course, that's what we do. So this has been a labor of love. I've been in the men's health sphere, as you said, since you were a resident. And so it's been 20 years in the making, basically, of trying to figure out how to simplify what I do and the key tenets of men's health. Because when we look at men in general, we tend to be not the best about going to the doctor. We need somebody else to push us in to make the appointments, whether it's for routine maintenance, like blood pressure checks, or whether it's getting your cholesterol screened, your colonoscopy, your prostate cancer assessments, all of that stuff. Somebody else is doing it for us. And unfortunately, what's happening these days is that there's a lot of information out on the internet, which I say unfortunate because people can be led astray. People can get confused with taking this supplement and your prostate problems will go away, or doing these exercises or doing this. So what I wanted to do is I wanted to combat a little bit of the misinformation out there and curate what I think is the best data-driven medicine, put it in a simple way. And so for me, the way to do that was in an easy to read, but I hope entertaining and somewhat fun book to read. So that's it. And we hoping if everything goes on, it's in the publisher's hands now. So she's working on getting things ready and hoping to get it on the shelves early 2021 so that it's the new year, new you wave. But it's going to touch on some diet, how to best optimize your nutrition, what to do for exercise, dispel some of the exercise myths, what's cardio, what's weight training, talk about sleep, because that's something that we don't know a lot about, and yet we should be spending a third of our life doing. So in men's health, sleep is very important because guys that don't get enough are more stressed, usually have poor lifestyle habits, obesity, low testosterone, poor sex drive, poor erections. So we're going to try to figure out how to sleep better. We're going to try to figure out how to do simple things to take care of your own health. And then we're going to dig into some of the more pressing questions, like how do you optimize sexual function? How do you monitor your testosterone levels effectively? How do you find a doctor that you can partner with? And then we'll get into all of the prostate cancer screening and colonoscopy and skin cancer and all the general men's health. So I'm hoping all within a few hundred pages, by the time it gets printed, you're going to have a guide that you can open up to any page and learn something about men's health and do something that's going to change what you do that day. And I hope actually what you do for the rest of your life.
Well, I really look forward to seeing that book, and so our listeners will be excited to see it too. So Dr. Mills, any final thoughts today for our listeners?
Yes, I think this is such a great forum for taking advantage of these expert opinions and the people that you have on here, Dr. Pullman, and then also just being proactive, speaking up for yourself, finding the physician that's the best fit for you is great, especially if you're doing something as technically demanding as prostate cancer surgery, and then also being part of the team and making sure that you're willing to invest in yourself, put in the reps, right? So it's not only what the surgeon does in the operating room, but it's what you do both pre and post that's going to give you the best outcomes, and really, really take advantage of the resources out there to get you optimized.
Well, I really enjoyed having you on the Prostate Health Podcast today, Dr. Mills. You continue to remain really a pioneer and true innovator for men's health today. And thank you for instilling our listeners with valuable information that can help improve their quality of life. Thank you again.
You're too kind, and good luck to you. Stay safe out there.
Will do. Thank you again for listening to the Prostate Health Podcast. Follow me on Twitter and Instagram at gpullmanmd. Don't forget to join us next week for another episode